Everyone. I'm sorry I was a little late getting on. I had some technical difficulties, but anyways, just wanted to first off thank you all for supporting our individuals. Our system is non-existent. There certainly doesn't work without all of you. I've been talking with other counties, and it seems, knock on wood, Portage County providers are holding up pretty well. And so, we're really proud of that. We've been stressing with the SSAs and Michelle and her crew to try and check not only on the individuals, but also on you so that we can support you during this very, challenging time. We felt that doing these kind of calls might be helpful. So we're going to try to do these weekly. That is if there's interest. And again, we want to help you out as much as possible. I just wanted to update everybody also on what we're doing here at the board. So most of the staff is working remotely. So about 75 to 85% of the staff are working remotely. We usually have somebody in the building all the time, though, at least in the administration. Outside of next Friday, we're going to close that building down for that day. But we're really not allowing visitors in. It's just staff are coming for those 25 to 15 to 25%. So they're forwarding their calls, they're checking their messages. So you shouldn't have any issues getting a hold of anyone. And of course, George and Barb sometimes are in the office a lot of times, but they also work remotely as well. Michelle and her team are mainly working remotely, but come in once in a while. Same with Kim and Kendall. And Gary Smith here, the Medicaid manager, is usually in the office, and Rachel is usually working remotely. We have support staff that are kind of in between. So really the biggest difference that we've seen is we just can't do face-to-face meetings or home visits. But we hope you're all seeing that we're able to still operate and help you out and help the individuals out. At least that's the hope. So this Zoom platform that we're trying out, we also did that with our board meeting in March. So we had 3 board members here, we had a few staff, and we had 3 board members at their home, and that worked out well. And that's why we decided to try to do this with all of you after we tested that out. I did want to let you know that DODD and the superintendent and OACB has been working to figure out other ways to help out providers. So I think they're going to be announcing something that will help all of you out here within the next day or two. So look for some guidance from DODD. That should be a positive to help you guys out during these challenging times. So that'll be great. And then, as you know, and Michelle will talk about it more, we've been checking, we've been planning things, trying to see how we can help out. We have a phone conference today with EMA to discuss, what would happen if there's a crisis situation in Portage. We hope there isn't, but we're always looking to try to find out ways. Hopefully you and your staff are doing the same, but we're in it together, and we're hopeful that we can avoid any major crises. The one thing that's been good is that most of our individuals aren't going places, so hopefully they're limiting their interactions, everybody's practicing the hand washing and social distancing, that we can avert some kind of major crisis here as well. So I'll turn it back to Michelle. I can't remember if Michelle's going to go next or if Kim and Kendall are going to talk about some guidance they had from the department.
Hey, thanks, John. Yes, I was going to have Kim and Kendall give the MUI updates, incident reporting, that new information that they have. So Kim, Kendall.
Hey, good morning, everybody. It's Kendall. And Kim, I think, is on as well.
Yes, I'm here.
Just had a couple of things for you guys. There is a new health and welfare alert out. It does cover infection control and the COVID-19. I looked over it this morning. It seems to be a lot of the same information that we've been all talking about for the last couple of weeks. But you could use it for a training tool or have people reference it if need be. The other thing that we had is that the state, and they should be putting something out soon, but just to give you a heads up, they are going to be asking for UIRs to document any time that you're dealing with COVID-19 testings and the outcome. The big piece of this, one, is for tracking, but also to put the prevention plan in place. So if someone goes to the doctor's office and is sent home, or if even the test is sent in the emergency room and they test positive and are sent home, it's not going to meet criteria for an MUI. but the agency needs to make sure that there's a prevention plan in place for the other individuals who reside in the home and for the staff that have been exposed. So that's the purpose of that. And then Kim and I also asked that you just give us a heads up, send us an email, or you can send us a copy of the UIR, whichever is the easiest for you, because we are keeping track of everybody that has been tested, and the state is asking us to keep them up to date on that. So far, there have been 9 people tested in our county, and they all have been negative. So that's all I have, but we're happy to answer any questions, or if you have any thoughts about that, we'll certainly take those back to the state.
Kendall, those 9, were those individuals being served or staff?
Those were all individuals being served.
Thank you.
All right, thank you, Kendall. And just a reminder to our participants, if you could please let us know who you are before you ask a question. That way, if there's any follow-up, we know who to address that with. Thank you. Next, I'd
Sorry,
like
that was Bill Ullman, sorry.
I recognize your voice, Bill, thanks. So next, I'd like to move on to Gary Smith, just to have him address briefly on billing, if there's any questions or concerns, and how to follow up with him if there is. Gary?
Hi, everybody. This is Gary Smith, Medicaid manager, after that introduction, which was very good. Thanks, Michelle. I don't really have anything to say. I just want to let everybody know there's like some new guidelines in being able to bill for services if they've been authorized by the SSA for whatever individuals you're providing services to. Basically, DODD says that any kind of electronic means of verification or authorizing is sufficient, and you can go into the billing system and bill for it. My understanding is that they've essentially neutralized or taken out the error codes in the billing processing, especially with dollar limits on IO waivers. So my phone number, if anyone needs help on deciphering anything that doesn't seem to be working right, please call me at area code 330-297-4134. That's my direct dial. Or you can reach me by email at gsmith@portagedd.org. Again, that's gsmith@portagedd.org. So if there were any questions about billing, you might want to take my number down and call me after, because sometimes they can be a little lengthy in the diagnostic area. If anybody has any other questions, I'll be glad to feel free. Otherwise, I'll let Michelle move on to the next subject.
Bill Ullman here with a question.
Hi, Bill.
Could you repeat that again about the error limits? If we got a pause, it says they're allowed to bill up to $10,000, but through all this process, we're at $12,000. Is that going to be a problem?
If it's an IO waiver, my understanding is that you can bill for, as long as it's authorized by the electronic means. You know, there's agreement between the SSA and yourself that the individual needs those services. I want to stress that. Billing system will not put any limits on the billing. No, that's correct.
Okay.
That's my understanding how it works. That's my understanding.
I understand
Yes,
that.
that's my understanding also. Yes.
Yes. Yeah, John, did you want to add anything to that? Did I state that correctly? I mean, it's a new area, a new realm for all of us to work out.
Yes, so the way it is, Bill and Gary and everybody, it's if your provider listed on the pause already, then you are actually able to bill for more than what's listed. But what we're doing is we're still getting the authorization. So you're still going through the SSA and saying you need this. And the SSA is then putting that in the addendum, putting it in the CPT, and then Gary and Rachel put it up. But let's say that they didn't get it to Gary and Rachel, but you agreed to it. You'll still be able to bill for it as long as you're a provider listed on the pause. So it's no different than any other time. It's still based on need. But if you guys have presented the need to the SSAs, you'll be able to bill whether Gary or Rachel put it in or not.
Yeah, it needs to be authorized by the SSA. It's, and the individual, of course, needs to have the services, that needs to be verified, and then the SSA will authorize it through some electronic means. And then, you got the green light on that then. Any other
Okay,
questions?
thank you.
Any other questions about the billing area, billing in general, or Medicaid? Okay, everybody, I'll turn over to Michelle. Thanks, Michelle. I appreciate it. If anybody needs to call me at 330-297-4134, just feel free to do that. Thank you.
Thank you very much, Gary. Appreciate that. Next, just some general, again, this is Michelle Dolensky, Community Provider Relations Department. I just want to remind folks that I am the single point of contact for any provider needs during this crisis and as provider relations all the time. But OACB had asked each county board to identify one person, and that list, actually Opera sent it out this morning. So for those of you who are Opera members, you should have got that. So it has every county and list who the single point of contact is. I can send that out to everyone this afternoon in a provider services email. That would be helpful. Also, our provider services department, relations department has been working on outreaching. So hopefully some of you have gotten calls from us. If not, we are trying to circle around to everyone just to check in, see if you have any needs, see how it's going for you. Again, just to make sure you know that we're there for you. So you're not alone. We're all together. We are also in the process of currently searching for vendors to get some resources. Like John said, we're trying to prepare if needed. So we do have some gloves. We're looking at getting some other sizes. Right now we only have size large. And then we do have a very limited number of surgical masks. And then we have an order for some N95 and more surgical masks. Those will be coming in about 3 weeks, which is right about when they're predicting the surge will happen. So hopefully those will come in. And then we do have some disposable gowns available. We also have some disposable ponchos, which is another thing that folks, if you can't find gowns, you can use the ponchos. Or even some people are just using a clear garbage bag, turning it over, cutting a hole in the bottom, putting it over, cutting armholes. We have, again, limited quantities of some disinfectant wipes. We've ordered some strip thermometers, which are reusable, and alcohol swabs to go with those to clean. We'll be getting about 100 of those in. Some disinfectant spray, antiseptic soap, peroxide, which also can be used as a disinfectant. And like I said, we're looking to order some medium and extra large gloves as well. So what we're hoping to do is have those supplies if there is an emergency need. If you have someone who is diagnosed, who's positive, again, we have very limited quantities, but if someone is in an emergency and needs those items, please contact me. We can discuss getting those to you. As John said, we do have a call with the EMA. Karen Hill has been in frequent contact with them, and they had asked that that any requests to the EMA from Portage County providers come through us, through the board. They just really don't have the capacity to be handling multiple people calling them. So at this time, if you have any needs regarding supplies that possibly the EMA has, please contact me and we'll get information for you and availability of the supplies. I've also created, we have a provider availability spreadsheet. So some of you have contacted me where you have additional hours for staff. I have that. It's accessible to all our SSAs. So if anybody out there has any available time in their schedule or any available staff that they've had to repurpose that aren't fully working and need more hours, again, please email me, michelld@portagedd.org, or you can call my office phone, 330-297-4186. and my phone is being forwarded to my home phone. So I'll get your call, or you can leave a voicemail if I'm not available. And that's about it. We're just really looking at trying to gear up, get prepared if there is a diagnosis, alternate living situations, staffing situations for folks. So at this time, I can open it up if there's anyone that has any questions general questions they'd like to ask.
Michelle, this is George. The only thing I'd like to add, if you guys are sending requests in for additional units or things that need to be addressed as far as the pause or billing issues, please copy Barb or I or both of us on the email when you send it in. I know the SSAs are all working remotely right now, and we are in the office quite a bit, so we can make sure that things get processed quickly for you all in a timely fashion. So please copy Barb or I or both of us on the emails that you send in. Thank you.
Okay, great. Thank you, George. Anyone else have any questions, comments, priority needs, anything that they need us to start looking at, working on?
Hey everyone, it's John again. I had to switch over to the phone because the audio on my computer wasn't very good. It was kind of garbled. So if any of you had that trouble, that's probably the best way to do it. But again, I think we just want to make sure the biggest part of having this is to let us know if there are needs out there that we can help you with. I think the department's also continuing to work on things and needs for you. So that's why I think you'll be getting something soon to help with that. But yeah, that's what we're here for. We know that we have to do this together. So if there's stuff that you're missing, like Michelle said, she's the point of contact, so we can reach out to her. But if there's anything right now pending, let us know now. Hopefully not, and that's the great thing. But we just want to make sure. The other thing is this good to offer these weekly? Are you guys okay with that? Any feedback about that would be great as well.
This is Steve Kolecki. As far as the weekly updates, I mean, if that's the best way to share information, then, you probably should continue them. At the same time, Opera has a weekly update, OHCA has a weekly update, and so, I mean, there's a lot of stuff that's being shared, which is great, some of it duplicative, but certainly makes sense to talk at the local level also.
Thanks, Steve. That's a great point. Yeah, and that's why we opened it up, just because we haven't done it yet, and we figured we should at least reach out and see if it turns out we're not getting people signing up and participating. Then of course we'll lessen that amount. Steve, how's things going at Hattie for you guys?
Well, I mean, overall we're in pretty good shape. Obviously, as was reported, no confirmed cases of COVID-19. I think probably all the tests that you reported were out of here. But we shut down access. My biggest concern obviously is the center. Our 124 residents here are pretty medically fragile, a lot of respiratory complications, so we have to be really careful here. But I think shutting down access to the building, including visitation and anybody from the outside, we did that 3 weeks ago now, has certainly helped. So knock on wood. We're okay right now on personal protective equipment and other supplies, but we have a lot of requests in the pipeline with our vendors. So that's my biggest concern. If we did have an exposure, with a resident who could not be transferred to a hospital, that would be a challenge for us, but hopefully we won't have to deal with that. We've had communication with both Akron Children's and UH, Rainbow Babies. They've been real supportive. And so, your comment about, or I forget who made the comment about making all requests through the county board. I mean, we're a little unique because, we have locations in multiple counties, but, I've talked to Ryan at Portage EMA directly. We've had some communication with the Region 5, although we're not a hospital, planning, just to try to figure out, how all this is going to come together if there is a surge in the area. So thanks for the question. Overall, I think we're in pretty good shape right now.
Great, Steve. Yeah, I think Michelle made that comment. I think Ryan was referring to her about like individual people just calling in. I think that's what.
Oh, I got you.
So I do want to applaud you because the other thing you guys did is I remember even before the schools closed, you stopped sending people out of the building like to go to our school, and that was probably a great thing to do as well. So we really appreciate that. Real quick, one other question, and we're just planning ahead, emergency type situation, not somebody that had the COVID, but let's say we had a parent, a caretaker who was unable to take care of one of our medically fragile. Do you guys still even have openings at the ICF?
Well, that's a great question. Actually, we have a conference call this afternoon with DODD to talk about, we are at our license capacity right now. So I've asked for some guidance on how we could flex. I mean, we could, I hate to use the term squeeze, but, we could add some folks here, but we're at our 124 license capacity. We do have the 2 respite beds. So actually this question came up, just so folks know, in the context of the hospital planning. Akron Children's approached us and said, apparently part of the plan is for Akron Children's perhaps be used for young adults, so that the adult hospitals would have extra capacity. They have a number of patients on vents who, asked if, we could temporarily take those folks. Well, there's 2 issues there. Is the DOD going to allow us to go over 124 license? And then more importantly, vent patients will be problematic. We have 15 residents on vents now. So, unless Akron Children's is going to send staff with them, that would be challenging. But it's not directly an answer to your question, but that's kind of what we're trying to figure out. Will they allow us to go past 124? My mindset is do what you need to do and ask for forgiveness later, but we're trying to get some guidance up front, so we'll see what they say. There's 5 ICFs in the state that provide vent services, I think only 5, and we're all on that call this afternoon. So.
Steve?
That's helpful, Steve.
Yeah.
Steve, this is Donna Clark asking a question. I'm an independent provider, and my client is medically fragile. When you say you're thinking that, maybe staff from Akron Children's would come, what about the possibility of the client's home providers coming, nursing staff?
The issue in our mind is more, nursing as well as the respiratory therapists that are needed. So I guess it depends on what's available.
Okay.
Yeah.
Okay, thank you.
Because with our current RT staff, we're okay right now, but with our current RT staff, 15 is the max that we can really manage, and
right.
It would be challenging for us to go beyond that right now. Yeah.
Mm-hmm.
It's a great program. We've had great results. We're getting increased, calls for the vent program, but again, staffing. The RT staffing is the biggest challenge. So.
Mm-hmm.
Thank you both.
thanks. Anybody else? Anybody else have any other questions or concerns?
Okay, well, sounds like there are no questions. If there are, again, you can, this is Michelle Delansky again, you can always email me, michelld@portagedd.org, 330-297-4186. I just want to remind you that this conference call has been recorded, so it will be, we'll get the information out if you need to review any of the content, or if there's any other folks that didn't get to listen that would like to, that you want to direct to that. We are going to go ahead and plan to have a meeting next week, and as John said, kind of assess week by week if we need to, how frequently we need to have those. So starting next week, this week was a combined call with independent and agency providers, just to kind of, again, kick it off our conference calls. Next week, we'll split it up. Independent provider meeting will be on Wednesday, April 8th at 10 a.m. Provider meeting on Thursday, April 9th at 10 a.m. And the information on how to log in to those meetings will be sent out in the provider services email to all of you. And, you know, again, anybody, invite other members of your staff who you feel should attend or you would like to have attend. And again, those meetings will also be recorded. So if you're that time doesn't work for you, you'll be able to listen in at your convenience. So at this time, I just want to thank all of you for participating in our meeting today. Very nice to hear from you. Those of you had comments, for the rest of you, as John said, we do really appreciate all the efforts, all the service and support you're providing to our folks. And again, we are here for you. Please reach out. You're not out there alone. As far as the supplies, you know, again, we have limited stuff, just as all of you are having supply problems, but we do have some. So if you are need, and you have an emergent need, please contact us and we'll do what we can to assist you. So if there is no further questions or comments. Hey, well, we will go ahead. Oh, someone have a comment?
No, I was just saying thanks, everyone. I was just wrapping it up. Thanks, everyone.
All right. Well, thank you.
Thank you.
Thank you.
Thank you.
Welcome. And we will go ahead and close our meeting out for today. Everyone, again, keep up the good work. Enjoy the rest of your day. I see a little bit of sunshine coming today, so hopefully that'll make spirits rise. Goodbye.
Bye. Bye, everyone.